It's 1 o'clock on a Friday. It's time for Facebook Friday again. Hello, everybody. I'm Kate Wakelin. I'm from Neuroendocrine Cancer Australia, and we're just doing these live feeds in our private discussion group every week, particularly while coronavirus is playing a major part of the melody of our lives, but also as an opportunity, I guess, to address some of the common topics of conversation that come up in the calls that I have with people throughout the week. The feedback's been really positive. So thanks everybody who's let us know that it's been helpful. That's really encouraging. It's nice to know that it's hitting the spot for people. And for me, I guess, to know that some of the information that I'll be giving, I give to people one-on-one. If that's helpful for more than one person at a time, then that's great, in terms of, sharing the information around in the most efficient way we can. And also, I just wanted to thank everybody for their comments and their feedback and participation in last week's Facebook Friday, where we had Associate Professor Lainey Cameron come along and give us some really fantastic information about exercise and cancer, particularly around our Let's Walk for Nets walking challenge. I found that a really useful session, and I know by the feedback that a lot of people did too. So I'll just let you know that the video for that has all been kind of stitched together. We took out the bit where we dropped out, and we've sort of stitched it together to make a little bit more of a tidy video that's now up on our YouTube channel. So if you want to watch the whole thing through without the interruptions, that's a good place to go. The other thing is that there were a couple of questions that people put into the feed, and Lainey was very kind, and we've been talking throughout the week about the answers to some of those questions. So I've actually put some of her comments in the comments field in the live video on the Facebook Friday. So if you can't find that, it's actually, there's a tab on our private discussion group for videos, and all of the videos that have been posted by anybody are in that section. So that's a good place to find it, because I know when there's lots of things that are coming through the feed, it can be hard to find things again. So let's move on to a little bit of an update about coronavirus. We're doing really well, and every day when I watch the press releases and listen to the analysis, we're more and more encouraged about the way that Australia have managed to really lock down and flatten that curve out. And what that means is that they are starting to ease restrictions on things like surgery, elective surgery, which is not so much related to cancer, but it is related to other, I guess, non-life-threatening issues that people might have. So that's really pleasing to know that the health services don't feel like they have to be in that state of high alert for a massive influx of intensive care admissions, because it seems hopefully that we've got this more under control. But the other thing is that cancer clinics are starting to relax a bit as well. And I was attending a teleconference last night with a number of the NET specialists from around Australia, and they were just talking about the fact that they've been needing to use telehealth, and they're starting to allow their clinics to have people come back into the clinic. They're starting to be a bit less worried about that sort of stuff. So we know that everybody's been really patient with bearing with their doctors and their health services and working with that telehealth. I actually think that we as a community have learnt some really useful lessons from that experience. And I think particularly for people who are rural, being able to engage in telehealth might be something that's really helpful for them on an ongoing basis. So there's been a lot of learnings. We've been able to pass some of your feedback on to those doctors, and I think they've found that really useful too. One of the things when we asked them, well, what would you say to patients? The response is, well, actually, they feel like patients are very worried about their well-being. They're worried about the clinics being overwhelmed by very sick people. They're worried that people are worked off their feet, and lots of people around Australia with NETs not turning up for their appointments because they're worried and they don't want their healthcare team to be working too hard, which is gorgeous of you, but please stop. Please go to your appointments. And if you're concerned, if you're not sure whether to come or not, or whether it will be a telehealth appointment, please get in touch with your clinic and let them know. Or if as always, if you've got something that you're concerned about, whether you're unwell, whether there's something that you're experiencing that you might think is a side effect, get in touch with your treatment team. They're missing you, and they want to have you back. They're concerned about missing potentially really serious things because people are holding off on asking for that advice and help. So I just really encourage you to feel confident that they're there and they're waiting and ready for you to be in touch with them and to be going along to those appointments. The other thing that came up in the conversation last night was we had a lot of nuclear medicine physicians at this particular teleconference, and they were talking about some concerns that people have had about the transportation and supply. Like often if we think about transportation and supply, we've been talking about somatostatin analogues, so people's injections, but also there's all of the radio tracers that they use in PET scans and what they use in their treatments. So I wanted to reassure you that that's all being very well looked after. There's certainly been some changes and some, shuffling and some new plans needing to be made in terms of getting those tracers to the right locations in time for those scans and things to be done. And I know there's a couple of areas in Australia, particularly Darwin and Tasmania, but also a bit in Perth. It's not so much the gallium-68 that's hard to get to places, but the people who are having FDG PET scans, I know for some people that's been coming late in the day, and those departments have been needing to ask patients to come in really late in the evening to have those scans because it deteriorates. It's got a half-life. It doesn't stay radioactive forever. So they've got to do that scan very quickly after that isotope arrives in the city. It's really it's a really interesting process, but it's very time sensitive. So again, we know that people have been probably inconvenienced by that, and thanks everybody for your patience and your forbearance, and we're looking forward to some of those things hopefully returning to a bit more normal really soon. But it varies from place to place. The take-home message is that they are still doing scans, and it's very much more returning to a business as usual model. So that's really great for our patients around Australia. So the topic of the week. This week there was a conversation on our Facebook group about vitamin B3, and I thought, gosh, it's been a little while since we've talked about it on our Facebook group, and maybe it's a good opportunity to address it during our video today. So people with NETs are often prone to vitamin deficiencies of all sorts, actually. There's a whole heap of different vitamins and minerals that you can be deficient in because of a neuroendocrine tumour. And that's for a number of reasons. That might be because of the treatment that you're having for the tumour, whether it's having a section of bowel taken out, for example, whether it's that you don't get as much in via your diet because your appetite's lower, whether it's that you've got a lot of diarrhea and the nutrients haven't had a chance to absorb, or whether it's a side effect from injections. But also vitamin B3 is a particular area of concern. So with some patients with neuroendocrine tumours, and this is not everybody, but about sort of half of our patients with gut neuroendocrine cancers, those tumours, and we've talked about this on previous Facebook Fridays, but those tumours still think that they're neuroendocrine, cells doing their job valiantly, and they think they need to produce lots of hormone, and they don't, because your body doesn't need that much serotonin being squirted out around, and it can make you very sick. But the tumours don't know that. The tumours really have lost all sense of reason and are squirting out hormone left, right and centre. So that's often serotonin in our gut tumours. Now, serotonin is synthesized in the body using a protein, using a building block called tryptophan. So it uses the tryptophan to make up the serotonin to squirt out into the body. The body also uses tryptophan for other things. So this is where vitamin B3 comes in, because vitamin B3 is actually synthesized in your body using tryptophan. So if your body is using up all of the tryptophan to make all of this useless serotonin, it doesn't have enough to create the vitamin B3 levels that your body needs to function well. So actually a lot of people with neuroendocrine tumours, particularly the ones in their gut, but serotonin producing tumours will often have a vitamin B3 deficiency. And there's a dietitian in Melbourne, she's almost doctor, but Erin Lang, who's actually completing her PhD in nutritional deficiencies in people with NETs. And she's gone through and tested extensively lots of different vitamins. And it's actually really leading from this research that we know this stuff. And she's in the process of publishing that data, which is really exciting. We're looking forward to seeing that coming out in the literature. But she's also come to our Melbourne support group a number of times, and she's also presented at our patient forums. So there are some videos from Erin on our YouTube channel, and I'd really encourage you, if you're interested in this or you think that this might apply to you, have a look at those videos, because she's an absolute gun on this stuff. And I'm a nurse, so I know a little bit about a lot of things. She knows a lot about that particular thing. So back to tryptophan, which the body uses both to make serotonin. Often people with NETs have too much serotonin, so they're using up all their tryptophan to do that rather than produce vitamin B3. So with vitamin B3 deficiency, the symptoms are actually really quite vague, and often you can have a deficiency and not really know that you've got it. It's not a simple blood test, and that's one of the things that's tricky. So if you're thinking about, if the doctor's sort of looking at you and you're not that well, they might do a blood test, but they can't test for vitamin B3. They can do vitamin B12 and all sorts of other vitamin Ds, but vitamin B3 doesn't show up in a blood test. It's actually it's a pain to test for. It's actually a 24-hour urine collection. So the current advice at the moment, the current thinking is that probably for people who with serotonin producing tumours, enough of them have a deficiency that we probably don't need to even worry about doing a 24-hour urine test for you. We probably can have enough evidence to give you a supplement of vitamin B3 on the basis that you get carcinoid syndrome and you're likely to be deficient in this vitamin. So the symptoms of vitamin B3 deficiency, for a mild case, you might be getting indigestion, you might be getting some fatigue. Mouth sores are a common one, and they're different from normal mouth ulcers. They're actually like a pale white or cream kind of coloured sore in the mouth. People can often have vomiting, but also low mood. So I'm just looking at that list and going, gosh, I've got NETs, who doesn't have fatigue, who doesn't feel a bit depressed. So this is, again, these symptoms are really vague. They can be from a number of different things. Also, if you're low in iron, you can have fatigue. If you've got cancer, you have got a higher risk of depression just because, cancer. So it's important to talk to your doctor and to be guided by your doctor, and also a dietitian if you can access a dietitian in that way. Severe vitamin B3 deficiency occurs over time, and the symptoms that can be really much more severe and actually can be really quite dangerous to have a severe vitamin B3 deficiency. So this is actually more than just a vitamin to make you feel good. This is actually can be life-threatening for people with a severe deficiency. So we want to get onto this. Severe vitamin B3 deficiency is called Pellagra. And the classic thing that people experience is a rash. You can also get dark pigmentation on your skin. The rash is often itchy, just to let you know. Dark pigmentation. You can get swelling in your mouth, and often people's tongues go bright red if they've got pellagra. Also headache, fatigue, depression, and difficulty in thinking clearly. So the vitamin B3 group, or the vitamin B group, and particularly vitamin B, are really essential for good neurological functioning. So you can also get like neuropathic pain, which is like a pain that can shoot or can tingle, like electric shocks or pins and needles, but also sort of, I guess, slowed and muddy thinking. And I guess that's where the fatigue and the depression might also come in. But sometimes people have difficulty with memory, making decisions that might be otherwise really quite simple to make. So if you get any of those symptoms, then please do see your doctor. You can ask for a test, and it's a 24-hour urine test, and if the doctor feels like that's appropriate, then sure. But if you get carcinoid syndrome, so that's what leads to the flushing and the diarrhea, sometimes a wheeze and shortness of breath, those symptoms, you're likely to be low in this vitamin. So supplementation is probably a good idea. like anything that you're putting into your body, talk to your doctor first. Don't just listen to me, talk to your doctor. So for treating vitamin B3 deficiency, there's two things. Certainly, we want to prevent it, and to prevent it, it's a much lower dose of the vitamin. So I'm going to look at my reference sheet, which is this fact sheet, which is on our website. Sorry for the promo plug, but it's a really fantastic fact sheet. You can see that I've highlighted on it because it's so useful. I keep it at my desk because I want to know this information. I want to have it at hand. So I'd encourage you to hop onto our website, which is allthews.neuroendocrine.org.au. And that has got the suggested dosage on it. So you don't have to try and remember what I'm telling you now. But for prevention, it's sort of between 20 and 40 milligrams of vitamin B3. If you've already got a deficiency, the recommended dosage is higher. So it's often above 100 milligrams per day. But obviously, if you felt like you had a deficiency, you were going to take that much, then I'd be talking to your doctor and a dietitian about that. You can take a vitamin B complex tablet, but it's worthwhile checking on the back of that bottle because some vitamin B3 complex sort of combination vitamin B3s, they don't have very much combination vitamin Bs, they don't have that much vitamin B3 in them. So some of them only have like 10 milligrams, which is probably not enough for you. So it's sort of making sure you take your good glasses to the pharmacy, or asking the pharmacy or the pharmacist or the pharmacy assistant to help you select the one that's best for you. As I said, there's heaps of other vitamins and minerals that you can have issues with NET. So I just would, again, plug the fact sheet. It was actually written by Erin Lang from Melbourne, but also a NET vitamin... Gosh, I'm really on fire today. Also a NET specialist dietitian from Sydney, whose name is Kaylee Lang. Kaylee Shade, gosh, I am so good today. Really on fire. I'm sorry. Apologies in advance for all of the other slips that are going to obviously happen. It's my day. Kaylee and Erin wrote this together. So this is the fact sheet to have a look at. So I'm just going to have a look at my list and see if there's anything else that I was going to tell you about vitamin B3. I may put some more things in the notes if I think of them later. But yeah, that's really the take home, that if you get carcinoid syndrome, you're more likely to be deficient. It's really important that you get on top of it so that you don't get horrible symptoms and we don't get, really quite severe and serious and life-threatening issues developing. Something that often they don't tell you on your first appointment with NETs, and so it's good to be in touch with that. Just a couple of little tiny things before I finish. The first thing is I was talking to someone just this 5 minutes ago. We just hung up the phone and we were talking about Google, and she was going, I know I shouldn't consult Dr. Google, but actually I'm really careful and I look at reputable sites. And we were sort of saying that Google can be a bit like a chainsaw, in that, it's a really, really useful tool. And if you've got a tree that needs trimming, then the person who comes, the arborist, they'll have a bunch of chainsaws and they're going to have a good look at your tree and trim it with the chainsaw. As the NET nurse, I use Google all the time. It's open on my computer all the time. It's a really useful tool. But like a chainsaw, I wouldn't give it to my 16-year-old daughter without quite a lot of guidance. I'd want to make sure that she knew what was safe to do with a chainsaw. I'd want to make sure that she knew the safety mechanism. I would want to make sure she was wearing protective clothing and being supervised. I'd want to make sure also that she knew which branches of the tree to cut off, so she didn't, have the tree fall down on top of her because she was so busy focusing on the chainsaw technique. So Google's a bit like a chainsaw. It can give you access to really, really useful information and lots of journal articles and really high quality evidence, peer-reviewed journal stuff. It's all on there. So it's not to say don't use it, but use it with care. It's a bit like a chainsaw in that you can come across completely inaccurate information. So anyone can post stuff on the internet, call it a fact, and it's not. The other thing is that you might come across information that might be accurate for somebody else, but doesn't really fit with your situation because every NET tumour is different. And so for information and advice about you and your situation, your doctor and your treatment team are going to be in the best position to help you with that. The other thing is that Google will often point to websites from overseas, and that can be really useful too. There's some really fantastic information on overseas websites. But the treatments that um, described and available overseas are different to what we have available in Australia. And actually, in a lot of cases with nets, we've got some treatments over here that a lot of people have trouble accessing overseas. So what you read about nets on an overseas website might skip out on a whole heap of stuff because it's not available there, but actually it might be a better treatment and we're using it here already. So use Google with care, a bit like a chainsaw. If you're worried about a site or you're wondering if it's a reasonable site, you can flick me a quick email or put it up in the Facebook group and see what other people say. We've got a wealth of experience and expertise in that group. A lot of people who've been living with these tumours a long time. So often there'll be people in the group who can help answer these questions too. Just a note on emailing me and sending me messages. Sometimes people do send me messages via Facebook Messenger, which is just, it's lovely that there is that connection there. I just want to let you know that it's tricky for me to keep in touch and keep track of those messages. And I don't know if any of you find this with Facebook, but once you've read the message, it sinks down through your message screen and for me, it reaches the bottom really fast. So I've got to remember to try and click on it to say unread message, and then I've got to try and reply to that message. And a couple of tricky things there. The first thing is that, again, it's hard for me to keep track of, so that if someone rings me then the next week, me being able to find, track down what I said, what we talked about, because I don't have a memory like a safe. It's a bit dodgy, so I do need to look back on my notes. And so if I've got text messages and Facebook messages and emails and phone notes and things, it all gets a little bit messy for me. But the other thing is that Facebook is a commercial entity. It's a really useful tool. We're using it right now. But when you send me a message on Facebook with all of the details of your treatment and your medical condition, you're also giving all of that information to Facebook. And we do want to be mindful of that just in terms of your health privacy. So the best ways of contacting me, there's two ways: via my phone, via the Net Nurse line, and I'll put that in the notes because I can't remember the phone number off the top of my head. That's really great going. So via the phone, and you know the deal, leave me a message. I'll be able to get back to you often within the day, but otherwise in the next day or two. I do work part-time, and so sometimes if I've got a bunch of messages to work through from the previous day, I might not be able to get back to you on that day, but it's usually within 24, 48 hours. Or email. And an email is great because I can see it. I know exactly sort of the nature of the inquiry. With emails, you can either get through to me via the Net Nurse email address, so that's netnurse at neuroendocrine.org.au. I'm getting better at this. Or you can, if that's too hard to remember, you can go to our website. That's got the Ask a Net Nurse form on it, and I know lots of you have actually found that and found it really quite useful. That gets a message directly through to me. Again, 24 to 48 hours for an answer. It may be that I can pick up the phone straight away and call you straight back, but I just don't want to promise that because some days are really busy, or I've got meetings, or I'm finishing up from the previous caller and I just can't quite get to you in time. So I guess I'm not an emergency line. Sometimes I get really distressed on a Monday morning because someone's left a message for me on a Friday night saying, Bob's got a temperature and he's really unwell and vomiting, and I'm like, oh, don't ring me, ring your hospital. So I'm not an emergency helpline, but very much as a resource for you to help navigate nets. So just wanted to finish on a positive note and saying what a great job you're all doing with your walking challenge. The competitive person in me is a bit sad that some of our pharmaceutical partners have got on board, and look, there is no more competitive people in the world than salespeople, and so there's no point even us looking at the leaderboard because we are being left behind by big mega teams. But I'm really pleased that they're getting in the spirit of it, because we want to raise awareness of nets, not only amongst patients and family and friends, but also health professionals. And we know these pharma companies, these drug companies, go out to see doctors and nurses all around the country. And so the more that they have nets in their forefront, then the more they'll think of talking about nets and the Neuroendocrine Cancer Australia, and the needs of people with NETs around the place. So it's really delightful. We've got over 165 participants in the challenge, and we've gone so far. I think we're somewhere around Darwin in terms of our trip around Australia. So we might even get a couple of laps in before the end of the challenge. One of the things that's been really exciting for me is after our conversation last week with Lanny is that I just saw some people who did a small walk, did a little thing, and that was, you know, like that was something we could celebrate. And that's what we want to see. It's not a competition. We know lots of you will not be okay with walking 10,000 steps. There's lots of days where, for me, walking 10,000 steps is quite frankly quite a stretch. So, you know, sometimes it's just a letterbox and back. Someone was painting their driveway, you know, so these small steps we really celebrate. But the other thing that I saw, and I can't remember who posted about it, but, you know, they're capable of walking for an hour, but it would wipe them out for the next 2 days. So they decided to walk for half an hour so that they had some fuel in the tank for the following day. And I think that is so great. I actually emailed Lainey after I saw that comment and said, look what people are doing. I'm so proud of them, because you obviously really listened to her talk, and I'm so pleased that that was, you know, clearly helpful. So I'm going to stop yabbering on, because my goal for the year is to be more concise, and yeah, I'll keep working on that one. But thank you for all your comments and your waves and things. I've given up trying to read and respond to the comments at the time, because I just end up losing my place in my brain. It's just not quite that good. But if there's comments with questions, I'll hop in afterwards and provide some answers on the chat field. So look, I hope you have a good weekend. Please stay safe, stay warm, you know, rug up and get out for a walk if you can. I'm here. I've got a few people who are still waiting for me to get back to them I've got 2 messages still from Wednesday, so I'm working through you guys. But yeah, look, I'm very happy for you to get in touch if you've got more questions. And I'll see you at Facebook Friday, next Friday at 1 o'clock. Have a think if there's a topic that you want me to talk about, if there's something that you're curious about knowing, or something that you know, a rumor that you've heard, let me know, and we can have a chat about that. So yeah, take care, and yeah, I'll talk to you soon. I've got to work out which button to press.